Hi, I'm Dr. Richard Greco from the Georgia Institute for Plastic Surgery. We're going to introduce you to a segment about how to age gracefully. Today you're going to meet many patients with many different stories. Some of the stories that I've seen over the years are pretty amazing.
So you go on vacation, look at pictures, and you go, who are those people? And it's not something that you necessarily see. So I think that's revealing, and you want to get something done about it. And of course, I've always known about plastic surgery because I deal with it in my day-to-day life and see the results of plastic surgeons and know that it's a safe and viable alternative for people.
I'm very pleased with it. I'd do it again.
I started to look a little old, and I just didn't feel old on the inside. I just looked old on the outside, and I have a younger wife. She has to look at me all the time, so I want to make sure that we kind of match.
Today we're going to talk about our experience and some of our patients that have had male cosmetic surgery. Over the last 15 years, the number of men having cosmetic surgery has increased significantly. We were on Good Morning America talking about how many more male facelifts we were doing today than we were in the past. Today, over 30% of my patients are men. Men are living longer, they're having second and third relationships, and they're working longer. They want to look young so they can compete with other people in the business world. They also want to compete in the world for second and third relationships. It is very important, however, that they don't look like they've been done. They have to look very natural. It could be something as simple as just having their eyes done to make them look less tired, more refreshed. Or it could include a facelift.
Now to the billion-dollar field of cosmetic surgery. It's not just for women anymore. More men are going under the knife, and as you'll see, it's not just about looking and feeling better, but keeping up at the workplace, too.
If I could turn back time.
From breast enhancement to Botox, it's no secret that some of Hollywood's biggest stars have gotten a little nip or tuck. But it's not just celebrities feeling the pressure, nor is it just women. More than 13 million cosmetic procedures were performed last year. But what you might not realize, over 1 million of them were on men. That's up 9% from 0 in the last decade.
It's tough to get old. It's scary.
Especially in today's economy, you got to look your best to, land the best job.
Those concerns could be changing the face of plastic surgery.
Males are more interested in cosmetic surgery today. 2 reasons. It's still somewhat associated with their job, but more is being married to a younger woman and getting older looking.
Dr. Richard Greco has been a plastic surgeon in Savannah, Georgia for 20 years. Working in a practice that once began with mostly female patients, but is now 20% men. Men like Brian Redmond.
I noticed I was getting what many people would call crow's feet, and I knew Botox would address that.
Now in his 50s, Redmond occasionally pops in for a treatment. Botox is the most popular cosmetic procedure among men. It takes about 20 minutes, and there's little downtime.
With men, the most important factors are A, looking very natural, and B is how long will it be before I will look normal? Because women use makeup and they can hide bruising, men can't.
For Redmond, it's a quick fix where the only thing that matters before and after is the way he feels.
My body's fit and I'm not overweight and I can run and do all kinds of active things. I guess I want to look the way I feel.
It makes you happy.
And Chester, we heard in that story, a lot of guys are considering this or going down that road because they want to be more competitive in the workplace. Is that a real pressure or one they're just imagining?
Oh, I think it's real pressure. You know, you want to look the part. When you go in, you want to look like the executive.
Let me bring you into this and talk about relationships. Not uncommon to see an older man with a younger woman. But a lot of times that age gap is huge. Yes. Not a big deal maybe at one point, but later on it does become.
Certainly later on it does become a bigger age gap, and I think those men feel...
driving a lot of guys?
Yeah, I think that is one of the issues driving men. I think it's much easier if a guy is married to a woman who is already getting plastic surgery, has received plastic surgery. And she might be a little more likely to be like, hey, you could do something with your eyes or your chin. But I think in general, guys do it for themselves. They do it to compete with other guys. They want to look just as much as they want to look good for other women.
Let me turn it around. Are some women put off by guys wanting to look that good? By guys going down the plastic surgery?
I think a lot of people are put off by plastic surgery. I mean, it's really the kind of thing, if you don't do it very discriminately and do it very selectively, you can really overdo it and you can start to look.
But what about your female partner? Is she going to be like?
I think a lot of times it really comes down to having a female partner who is already in that mindset, who has already maybe done that kind of work.
But let's add a new wrinkle on this, pun intended. We have guys now who are divorced getting back into the dating scene. They may want to date women who are their own ages, mature women, but now some of them are cougars and they're going for the younger guys. So now these guys are competing with the younger guys for women too. So that's part of getting some of these procedures.
Here's the thing. I think, you know, the big driver of productivity in the workplace is this sense of well-being. So to your point, if you feel good about yourself, you're going to be more productive. But if you overdo it, I mean, there's nothing worse than a bad plastic surgery job. You know, the Michael Jackson kind of syndrome.
So gentlemen, thanks.
Today you're going to meet a few of my patients who will tell you about their experience with facial aesthetic surgery and how it has made them feel about themselves.
I've got a friend. He's very particular about his car. He had a car and kept it immaculate. And anything happened to it, he'd always fix it, kept it shining. But he had his teeth bad in front. And so I told my wife, I said, this fella, I said, he cares more about his car than he does his face. And I said, that's not going to be the case with me. I said, if I can have my car painted when it gets rusty and bumps on it, I said, then I care a lot more about my face than I do my car. And that's what caused me to make my decision on it. Most of the time I don't feel 75. I try to keep busy, very active. My wife, she tried to talk me out of it because she said I didn't need it. So you look okay like you are. But if you want to get it done, go ahead, but I really don't think you need it. Well, I picked Dr. Dreco because I did some research on him, and I saw his resume, his history. After checking him out, and I decided that he would be the one to do it and go ahead and get it done. There was a remarkable difference. Comments that I made, my relatives that I've not seen for a while, they all make comments about it, how well I look and how young I look and so forth. So I'm very pleased with it. I'd do it again. I'm satisfied with it.
There are two ways to look at facial aging. The first question is, what bothers you? Obviously, I want to address your concerns, the areas that you think make you look older. Secondly, many times my patients say, Doctor, tell me, what can you do to help me look younger? And then I'm going to talk to you a little bit about how we address that. So first, when you come in, if you bring photographs of yourself from when you were younger and what you hope to look like again, that helps us see where you came from. Then we can look at your photographs now, either that you brought or that we will take, and determine what are the signs of aging that we can improve. Start at the top with your hair. What is the density? What is the position of your forehead? How high is your forehead? We look at your brow position, how many wrinkles you have on your forehead. Do you have wrinkles between your eyebrows? Do you have loose skin of your upper eyelids? Are your lower eyelids puffy? Do you have quote-unquote bags beneath your lower eyelids? Do you have significant jowling? Are there deep lines in your nasolabial fold? How long is your upper lip? Are there lots of wrinkles around your lips? And then what is the status of your neck? Is it very full? Is there loose skin? Is it just pudgy? All those things can be addressed, only if they bother you. So we will take photographs of you, and then we will look on a computer and try to morph or modify your photographs to see how much improvement you want and what changes make you look more like you used to look like. My goal is not for you to look like somebody different, just like you used to look like 10 or 15 years ago. Every employee knows that confidentiality is important, that great customer service is important, And we hire people who have that attitude and we train them for their positions. Because of that, most people rave about their experience at our practice. Patient education is a very vital component of plastic surgery. The first thing you have to do is find patients and make sure that they have realistic expectations, and we can discuss what it actually is possible and what is not possible. We don't want them to go through a procedure and at the end say, geez, I thought it was going to be X, when that's not actually a possibility. You make your reputation by who you say no to, not who you say yes to. So there are certainly patients out there that are not good candidates for plastic surgery, and we have to find those and not operate on those patients. And then once we find people who do need our help, we try to help them in our best fashion and the safest fashion possible. Today we're going to do a show about men and facial rejuvenation. You know, the demographics are in 1960, men lived to about 65 years old. So as we get older, we became distinguished. Today, men are living to 78. You can't even retire till you're 67, and many men are working till 70. Sometimes we're having a second and third relationship, and it's important that we look as good as we feel. It's very important in men that you don't look like you've had a facelift. 20 years ago, women had cosmetic surgery and were very quiet about it. Today, women are very open about cosmetic surgery. Today, men are having cosmetic surgery, but they don't want anybody to know about it. 30% of the facelifts I do today are in men. When I was on Good Morning America talking about male plastic surgery, what we talked about was the fact that our men are living longer, they're having more relationships, second and third relationships, and they're working longer. So they want to look as good as they feel. The first facelift I did on a man was a gentleman who was 64 years old. He got downsized in the bank industry as a VP. For 6 months, he couldn't get a job. He had a facelift, and 6 weeks later, he was a VP of a bank again. Is there age discrimination? I believe there is. If you can, maybe he just projected more confidence. I'm not sure. But men are learning the value of cosmetic surgery in 2015.
Problem with my eyes and just exposure over the years and lost a lot of my peripheral vision. So I went to the ophthalmologist and they did peripheral vision tests and I just wanted to have that corrected. And then while I was corrected, there was just other things that were done, just tweak things or lift things up around your eye level just so you just don't feel or look so tired. Well, Savannah's blessed with many good physicians, and I've had patients over the years that have been to, I had one, went to every single, I say every single, but at least 7 plastic surgeons in Savannah, and just told me what they thought of the process and all of that. And then you see somebody have a procedure done and say, well, who did that? And it's just like looking at artwork. It's obvious after a while whose work is really, really good. Dr. Greco just is excellent. I told her the other day, I said, gosh, you can't even see your scars. That's like really, really good, because that's what people are concerned about, the scars. And then probably more important than that, when you get a result that people don't know you have plastic surgery, because people generally want that to be very private to them, and so you don't want to look like so different that it had. You just want to look better, and people can't really tell why you look better. He makes someone feel very comfortable, and I think that's important too. If you have a physician-patient relationship, you want to feel comfortable that they're going to do a good job, but that also that you're not that you'll speak with them and communicate with them. And then, of course, the process about just how it was all set up, there's no pressuring like you need this or you need that. It's more of like, this is available. So this is something you might consider, and then you consider it, and then they just take care of it.
The University of Pittsburgh has been for the last 25 years one of the top 3 plastic surgery programs in the country. And it creates many of the other program chairmen. And it was really my first choice of where to train. My dad was a general and thoracic surgeon, and I started operating with him when I was 12 years old. And I always thought I was going to be a cardiothoracic surgeon. And when I was in medical school, my sister actually had an operation, and she went from the most quiet introvert to the most outgoing extrovert. So I said to my dad, what happened? And he said she had a breast augmentation. And it was amazing to me that I realized that an operation can totally change the way a person perceives himself. And so I thought, well, I'm going to look into this. So when I was in medical school, I did a 1-month rotation at Stanford University out in California in plastic surgery, and I did a 1-month rotation with one of the best heart surgeons in the world at Jefferson in Philadelphia. And at the end of it, I realized that plastic surgery allows me to look at each problem and create a new solution. You have to use artistry, you have to use your knowledge and your skills to get the result you want. And so every day is a new exciting day, and that's why I became a plastic surgeon.
I have no scars. I know that they warn you always about things that could go wrong. They have to do that, but they say you can expect to ever pull your hair back in a ponytail for all the scars behind your ears, but I always wear my hair in a ponytail. So I can't say, I can't say that's true. Craiggo's just such a professional, and his ability to prevent the scarring is just astronomical. I mean, he is just the best. I don't have any scars that I can see at all. And they know exactly who you are. Even after 9 years, they just know who you are and how you do. And in 2 days, and no big deal, and 2 weeks later, you're out at the gym.
So today we're going to talk about my approach to facial rejuvenation, specifically if you need to have a facelift. So the first thing we're going to do is we're going to evaluate you in my office. We're going to take and just sort of lift with our fingers gently and let you look in front of a mirror to see if that is the look that you're trying to achieve. We're going to take some photographs of you and we're going to put it on a computer system called mirror imaging, and we're going to morph your photographs to show you what you might look like if you were to have a facelift. Once you decide this is something that you need, we're going to talk about what it means to go through surgery.
The whole experience at this facility was very positive. I never felt pressured. The first thing they did, they were very smart. They put me in Dr. Greco's office, and I went in the room, and there were all these books, and I was there for about 20 minutes, and I went through all of these books, and I was amazed. In fact, one of the women I just met was in that book, and I remembered her from the picture because it was absolutely amazing what they were able to do.
You'll come in, and the young ladies will give you some pills to make you groggy. We're going to put an IV in your arm. We're going to make you groggier. You're going to go back to the operating room after we've had an opportunity to talk about your goals again. And the operation is done under sedation. You're not actually put to sleep completely. You're not aware of what's going on, but you're actually, it's safer not to have a tube down in your throat, so you're breathing for yourself. The operation itself will take anywhere from 2 to 4 hours, depending upon what exact procedures we're going to do. When you wake up, you'll be in one of our recovery beds, and you're going to spend the night here where the nurses will take care of you for the next 24 hours.
His staff, by far, is the best. I mean, Miss Beverly is just one of the best. She's just such a caring nurse.
The benefits of going to a surgery center over the hospital, I think, are huge. Number one, our facility has 0 infection rate. Most patients are not here longer than 4 hours from beginning to end of their surgery time and their exit time. Because you're dealing with the same people over and over again, and we're doing the same surgery over and over again, we're very competent. When you go to a hospital, you don't know who's going to put you to sleep. You don't know who the nurses are going to be in the room with you. We always know who that's going to be here.
You're going to be sitting slightly upright in order to keep the swelling down. They'll be using some cool ice compresses to keep the swelling down from your face. And the following morning, you're going to go home, and you're going to have someone help take care of you for about 1 day. You'll then come back and visit us, and we're going to take out all your drains. And then you'll just have some suture lines. Now, I won't lie to you, you will swell up, and the worst swelling is between days 3 and 5. I tell all my patients, you're achy, swollen, and say, why the heck did I ever do this? But by about day 6, you're gonna know why. The swelling will start coming down, your new youthful appearance will start showing. At day 5, we're going to take out your sutures in front of your ears, and all your sutures around your eyes, if you have your eyes done, will be out. Usually by day 6 or 7, with sunglasses, you can go to the grocery store. Then usually by day 10, the swelling is gone down enough that you feel comfortable enough to go out to dinner with your spouse or go back to work with a little bit of makeup on. And by 2 weeks, you're going to be ready to go to a cocktail party. By that time, we're going to have all your sutures and staples out, and you're going to look better than you did before surgery.
And mine's cleared up real quick. As a matter of fact, the doctor was amazed at how fast mine's healed.
Now, I will tell you, over the next 4 to 6 weeks, as all the rest of the swelling goes down, you're going to look even better. And at 3 months, you look better than you do at 2 weeks, because the scars will have settled down and the swelling will have been gone. And really at a year, the scars will almost become imperceptible, and that'll really be even the best time. Even without makeup, you're going to look great. So it does take time to recuperate from having a facelift. It does not hurt. If you have pain, there's something wrong. You will be swollen, it will be achy, and sometimes people are a little bit stiff or achy in the neck because we sew the muscles back to give you a really nice, smooth neck. But the operation itself, almost all my patients will tell you that it's nowhere near as bad as they thought it was going to be. So if it's something you're thinking about, you certainly can come. We'll be happy to talk to you about it. If you don't know anybody who's had a facelift, we can put you in contact with somebody who has, and they can tell you about their experience. It's important to feel very comfortable whenever you have elective surgery, and we're going to help you get there.
I met Dr. Greco about 5 years ago, and probably even longer than that. Talking to Dr. Greco, my main concern at the time was that my eyes started to droop on the sides and started to take a little bit of my sight away. And while we were talking, I felt so comfortable with him and what he was explaining to me what to expect and what the recovery time was. We started talking about something on my neck, below my eyes, above my eyes, my forehead, and we just decided to do the whole entire facelift. I started to look a little old, and I just didn't feel old on the inside. I just looked old on the outside, and I have a younger wife. She has to look at me all the time, so I want to make sure that we kind of match. It was, you should really do it, honey.
So what are the next steps about seeing a board-certified plastic surgeon? The first thing is call the office. See how responsive they are to you. See what kind of information they send you about the proposed problems or procedures. How long is it going to take to get to be seen? You should be able to be seen within 2 to 4 weeks for sure. Come in at your convenience. Meet the staff. You should be able to have photographs taken of you, and they should be able to be reviewed by you and the doctor on a screen. They should be able to help show you what you might look like if you decide to have surgery. You should be able to ask questions and watch videos about different proposed procedures. Learn about the risks and complications. Be able to see some photographs of some of his before and after photographs. And some doctors might even make it possible for you to talk to previous patients if you have questions. Make sure the nursing staff is responsive to you as well as their patient care coordinators. When you call, do they respond quickly? If they don't respond before surgery, they probably won't respond after surgery. So make sure you feel very comfortable both with the abilities of your surgeon as well as the kind of experience that you're going to receive from them.
Dr. Greco is a really good personality for this sort of job, and especially plastic surgeons, since they tend to be skilled. It's hard to have personality and skills like that together, but I think he has a good combination of both, and he's concerned about your well-being, and you don't ever feel like financial issues are what's driving what he does. I think just like any artist, he wants to have good results. I think that's what drives most of us, is the results that we get. So it's kind of like playing golf and hitting a really, really good golf shot. It makes you feel good, and I think that's how he feels about the work that he does.
But my wife, she's 4 years younger than I am, so she looks very young anyway. And that's another reason why I wanted to get it done, because she looks very young.
Today we're going to talk about what procedures are men having. So when we start from the top, sometimes men think that they're too balding, and hair transplantations can be done to improve the thickness of their hair or to create a new hairline. Sometimes they have very deep brows and they need to have their eyebrows raised, called a brow lift. Many men have loose skin of the upper and lower eyelids, and that's the simplest operation to make you look younger. It's called a blepharoplasty. Today, men are even having facelifts. It's very important in a man that they don't look like they've had a facelift. They cannot tolerate looking like they've been done. It's very important they look natural and the scars are hidden. A facelift scar is hidden in the hairline, in front of your ears, up behind your ears, and back into the hairline. In the last 3 months, I've done 2 bald men who wanted to have facelifts, and their scars have healed beautifully. So even if you don't have hair to hide the scars can heal beautifully and you still can be rejuvenated. In addition, many men are interested in seeing their neck improved. That's part of a facelift, but you can just do the neck if that's all that bothers you. Men are now thinking about liposuction, sometimes to their breast, to their tummy, and their love handles. If any of these things bother you, come see us and we can discuss what might be done to help you look and feel as good as you feel. People ask me, why do I love doing facial aesthetic surgery so much? And part of it's probably because I'm sort of growing older myself, and I've seen my wife and my mom and other people grow old, and I've been able to help some of these people age very gracefully, and I've seen the differences it's made in their lives, and I've been able to help so many patients over the last 20 years, probably have performed over 500 facelifts by now, and have watched the impact it's had on those patients and feeling good about themselves and keeping their relationships strong. And so I really do enjoy helping people look good so they can feel good for themselves and for their families. And it's a very rewarding procedure and group of procedures because patients are very appreciative. This is elective surgery. People don't have to have it performed. They do it because they want to. They want to look as young as they feel. And I want to be able to help them feel that way. Many of these patients have worked hard their entire life, either as mothers or working in industry, and now they want to spend some time enjoying their life, dancing, playing golf, traveling. And they don't want to be perceived as old people. They want to be perceived to be as young as they feel. And I want to help them do that. And I can.
There's nothing worse than being old, single, and divorced. So I figured, you know what? If I'm going to be divorced and single, I'm sure as heck going to look great. So Dr. Greco has done a couple of procedures, and the last one was my facelift. I feel like $1 million, and I play tennis with his wife, Robin. And I just think he's absolutely fabulous. I trust him with everything.
So why is there such an explosion of interest in facial aesthetic surgery? Well, in the 60s, when they invented Social Security, what percentage of the country lived past 65? 1%. Today, the average age that we live to is 78. And more people are living into their 80s and 90s. And not only are they living into their 80s and 90s, they're still enjoying life. They're active, they're dancing, they're playing golf. They want to enjoy life. Medicine has helped people live longer. Unfortunately, we've not found ways to make people look as young as they feel. And so people are, especially men, we used to live to about 65 or 66, and we grew to become distinguished. Now we're living into our 70s, and we're getting old looking. And so there's a rejuvenation desire by these young at heart men who want to enjoy life. And so the question is, what can we do to help them? And that's what facial rejuvenation, surgery, and procedures are all about. And allowing people to enjoy the next 20 years of their life so that they could look and feel as young as they actually feel.